there's that.
Anyways, we got a little fired up.
Here's my takeaway. Here's what I'm going to say. If a man is saying something, I'm not just going to believe it. Welcome to Pelvic POV with your hosts and doctors of physical therapy, Amanda Neary and Hannah Meyer. Hey, pelvic freaks. Welcome back to another episode of Pelvic POV.
We're your freaks for us and we're freaks for your pelvis, baby.
Hello. What's up? I feel like we should circle back. It's January. It's the month of circling back. Do you see all the memes?
No. What's going on?
January 2nd. It's like, this is a big day for people that circle back.
Okay. Love that.
It's like a workplace meme.
Yeah, I get it.
Anyway, she gets it. Anyway, we are circling back because we talked about, I think a few episodes ago, on the smear campaign thing when Blake Lively's lawsuit came out. And then since then, Justin Baldoni released his lawsuit. And so there's like frequently new information growing in this particular situation. And honestly, just taking the people out, I feel like we should talk about it because we talked about it before. Now there's new information. I think taking the people out of it, who you like, who you don't like, my point remains the same, which is that there's a lot of misogyny involved in how people are interpreting these two people in the public eye, particularly when I'm like scrolling through TikTok and I see someone commenting. Basically, when Blake released her side of the story, her information, people were very quick to be like, I need to see what Justin has to say. For some reason, I don't believe it. I don't like her. She's not likable. She sucks. Just like negative response to that. And then I saw like the select few videos that were actually reading her information and were like, this is where like she claims to have emotional abuse and blah, blah. And like all of these very real things that may have happened. And then Justin releases his lawsuit and scrolling through again, seeing the immediate comments like, I knew it. Thank God he said his side of the story. Like she's done for it. This will ruin her career. Like, thank God no one will ever work with her again. And I'm just like, it doesn't take a highly intelligent, profound person to understand that there is misogyny involved with that feeling of like sitting on the edge of your seat, being uncomfortable that a woman has a side to a story that she's telling publicly. And you can't sit in that comfort just like listening to her or like seeing what the facts are and taking it day by day, regardless of how it ends up and who's right in what ways. And there could be rights and wrongs on multiple sides of the story. Like the point is that there, even regardless of who's right, who's wrong, there is misogyny involved in the interpretation of this. Would you agree?
Yeah. We weren't on the set of It Ends With Us. Were you guys on the set of the recording of It Ends With Us? Do you know what really went down? At the end of the day, what we're trying to say is regardless of who's right, who's wrong, the problem is associated with how the public reacts to when a woman is misrepresented in the media or how a woman is represented in the media. They just want to tear her down versus how a man is represented in the media. They're going to just keep building up and supporting him.
Look at Ariana Grande.
People are very quick to just tear women down, especially highly successful, strong, confident women. So quick to tear them down. Let's talk about Ariana Grande, for example. She is one of the most famous pop stars, I would say, in this generation.
Yeah.
And she popped off with what was her album with the ponytail? Thank You Next.
Thank You Next.
She popped off with Thank You Next. She's popped off with all her albums. That was my favorite one. But she was at the height of her career. She was casted for Wicked, for Glinda in Wicked. And I think that's something that she's wanted like her whole life. So she's at the top of her career. And the first instance of her maybe messing up or the tiniest little tip to Dumois or the tabloids, people just jumped on it to try to destroy her and take her career down and ruin her reputation as fast as they could. So obviously you guys know at this point, for sure, you know, the tea with Ariana Grande is that everyone is saying she's a homewrecker because she stole Ethan Slater away from his wife and his newborn baby. And then she was cheated. They were cheating on this relationship, whatever. Okay. And it came out that this is not true. You want to talk about that?
So Ethan Slater's his ex came out and finally wrote her side of the story. And basically she said it was 9 months after they separated. And she wrote about how it was really hard for her. And that's a whole nother thing. You can absolutely feel for this person. That's a horrible situation to be in. your husband leaves you right after the birth of your child, like that side of it, fully respect. But the facts are that Ariana Grande did not steal this man while they were still together. It was after a separation. And the fact that people were just not only, it's not even about them saying, oh, that was shitty. She cheated. She stole him. It's that it was all about her. No one cared that this man left his wife and his baby. They cared that she took him from them, as if he isn't a grown man with a developed prefrontal cortex that can make his own decisions. Get off her dick. That was not her problem. She's just living her life. If you've ever watched an interview with Ariana Grande, that girl is trying to survive half the time. She has been through a lot of shit too. And she's finally thriving in this dream role. Can we just let her have this one thing as a successful woman? It's not about her. It's about him and his family and what he's doing. So make it about the man. Put the accountability on the man for once.
The more successful a woman gets, the more confident, the more talented someone is, and the more a woman is thriving in her career, the more the public and the media want to take her down. If you look up Ariana Grande right now in the media, I guarantee you the first thing to come up is this little like home wrecking tabloid story. For one. Number two is going to be, she's so skinny. Her weight, is Ariana Grande okay? This is what happened to Ariana Grande. It's all clickbait. Or it's like, Ariana Grande got this done. She got Botox and fillers and blah, blah, blah. And she's just constantly having to defend herself. And you can see nowadays when she does interviews, she just jokes about it and tries to make it lighthearted. Like I think she got that award, right? They handed her the award and then she acted like it was so heavy that it was weighing her down because she was joking about how everyone's commenting on her weight and being like, is Ariana Grande okay? Is she dying? And she's just like, what the hell? Why can't I just survive?
Yeah.
Like you can't, as a woman, you can't be skinny. You can't be fat. You can't have big tits. You can't have no tits. You can't have an ass. No one will ever be happy with the way you look or the way you are, and people will always tear you down. So at the end of the day, who gives a fuck?
I love
All
that.
right?
At the end of the day, just do what you're going to do.
Mm-hmm.
You're going to get criticized for it anyway.
Ariana
So you
Grande
might as well just live.
Exactly. And Ariana Grande is a perfect example. Like one of the most successful pop stars, I would say. Look at like Lady Gaga when she was at the height of her career and they were like, there's rumors going around that you have a dick. And she was like, maybe I do. Yeah. She was like, what the hell? Like I'm at the height of my career and people are like, oh, Lady Gaga has a penis. Yeah, she has to have a penis to be a successful person. Excuse me? That's so weird. Anyways.
It's weird.
The reason we're talking about this is because, well, this has to be addressed first of all. But with Blake Lively coming out and saying her side of the story, for example, and the way the media was so quick to jump on her and be like, you're wrong, you suck, Justin's right, we're going to tear you down and ruin your career. Hell yeah, and everyone's so happy about it. This is why women historically never step forward when something is going wrong. And then they eventually do. And then people are like, she never said anything. It took her so long to finally step out and say something. There's no way this is true. This is the reason people don't want to say stuff, because people historically just don't like to believe women or trust women.
Yeah. And think about it. When there is a case, when you have a case against someone, how many times is that completely black and white? There's going to be nuance. There's going to be things on this side that this person can say you did. There's going to be things on this side that this person can say you did. The overarching wrong might be on one side. It might, let's put like, I'm not actually talking about Blake and Justin here. I'm just giving an example of someone like really wrongs someone. That person can probably still say like, oh, well, they like mentally, they did this, this, and this. And if that person that did the lesser evil is a woman, people are still going to pick at that and say, well, she did this, so she deserved it. She did this, blah, blah, blah. So of course, women don't want to come forward because that's how they're perceived when they say these things. And then you have cases that are black and white and women still don't want to come forward because then you're like probably dealing with more legal intervention and things that aren't also taken seriously for women. So yeah, it's just frustrating. At the end of the day, everyone is a victim of patriarchal thinking, men and women. There are a lot of women who hate women. There's a lot of internalized misogyny. I actually loved, if you're interested in reading more about this, I love Drew Afawalo's book, Loud. She wrote it last year. And that's her whole thing. Her whole platform is talking about like the patriarchy and how it impacts women and women of color specifically.
God, I love her.
She's so awesome. And the book was great. It was a great audiobook, super quick, and she dives more into this than we would on this podcast. So go read that. That was awesome. Also, just side note, her album, Ari's album, Eternal Sunshine, got me through my last breakup. So I have a personal soft spot for Ari.
I think that's why we kind of went in on this conversation.
We use that as an example because it's a good example. It's a recent example, but also we like her. So there's that.
Anyways, we got a little fired up.
Here's my takeaway. Here's what I'm going to say. If a man is saying something, I'm not just going to believe it. I'm not. And we need to be that way, not to like even the playing field per se, but because it's important. It's like he said it, so it's right. So fuck her. And I'm just not going to be doing that. I already like subconsciously do that. That's like me as a person. But like, why would I believe a man? Why? Why would I believe a man?
You should have worn your I've literally never met a man shirt that I got you.
I really should have. I'm going to wear it for the next one.
I got Amanda for Christmas. I got her these like baby tees that have funny sayings on them. And one of them says, I've literally never met a man. And I was like, this is Amanda. If I've ever seen a shirt, this is for her.
I'll wear it for the next one and I'll repeat that sentiment while I'm wearing it.
Gorgeous. Yeah. At the end of the day, I say that all the time. At the end of the day.
Do you have an at the end of the day?
I do. We're not saying, okay, Blake Lively's wrong and Justin's right, or Justin's wrong, Blake Lively's right. We haven't read the lawsuits. We're literally just looking at the media, the representation in the media of a man versus a woman. And it's just been a very interesting thing to look at in the media.
Yeah.
It's just been a very interesting thing to look at. And we wanted you guys to hear our little blurb and takeaways from that.
And that was a good amount of banter.
It was. There's more information coming out about it all the time. So we wanted to address it.
Yeah. And going forward, regardless of what ends up coming out about it, regardless of who wins, because that doesn't actually matter, regardless of who ends up being in the right, everything we've said today is still true.
Yep.
So get out of here.
Yup.
Grow up.
Do you guys want to hear what we actually came here to talk about? Because Amanda and I got on the biggest rant. I was just reacting to you. That's why.
All right, should we get into the topic of the sode?
Should we? Guys.
Before we get into the topic of this episode, I do want to put a content warning on this because we may be talking about instances of sexual trauma or abuse. So if that is not what you want to be listening to today for whatever reason, then you may not want to go forward in this episode. So if you listened to us last week, we talked about pain with sex and we talked about when that is due to a physical symptom that we can treat in PT and when that might have some other factors involved, whether it's like honestly just not liking your partner or having psychosocial factors or other things that we can flag and refer out to.
We want to start addressing specific diagnoses for you all to come back and reference. So we had our endometriosis episode, for example. If you guys have any other diagnoses you would like us to dive into about how we treat as pelvic floor PT, what this patient population looks like, symptoms, etc., we'll dive deeper. So today we want to talk about vaginismus.
Yes.
And if you want, we can give you the literal textbook dictionary definition of vaginismus
Let's
so
do
that
it.
you understand exactly what it is. So the first thing that come up, vaginismus is a sexual pain disorder that involves involuntary contractions of the vaginal muscles, making vaginal penetration difficult or impossible. It can cause pain, burning, or a feeling of hitting a wall during penetration. Other symptoms include difficulty inserting a tampon, difficulty undergoing a pelvic exam, so like a speculum exam, inserting a speculum, pain with sex, loss of sexual desire.
Yeah. So this condition encompasses a lot of different causes of pelvic pain, but the gist is that like any insertional stimulus would cause this involuntary reaction. Often when people come to pelvic floor PT and they have vaginismus, they do have a diagnosis, but we also see a lot of patients that don't have a diagnosis and are coming and they just describe it as painful intimacy. So that's why we want to address this specific condition after what we talked about last week, because it is a common one that we treat. And no, it's not normal. And yes, it can be helped.
I also wanted to say something weird when I was reading the Cleveland Clinic definition, dude, which is like literally a .org, okay? It says, vaginismus can make intercourse painful, which fair. Yes, it can. Kegels, And cognitive behavioral therapy and dilators can help relax the muscles and stop spasms.
Whoa.
Kegels, honey.
Kegels do not relax the muscles.
Kegels do not relax the muscles. I will occasionally sometimes have people Kegel to maybe try to fatigue the muscle than to try to stretch. But I will never, if you have vaginismus or increased soft tissue restrictions in your pelvic floor muscles that make it difficult to even insert a finger or a tampon, I'm not going to send you home and have you do Kegels.
100%. I think they can be used in a skilled setting, 100%. So like
with your PT.
Yeah, if you're doing internal work, Kegel and then try to lengthen more after, for sure. But you need that cueing. You need that internal feedback to know that it's actually doing what you want it to do. I would never just prescribe someone Kegels for something like this. Vaginismus, if you have been diagnosed with this and you're like, what the heck? Or you are listening to this and you're like, wait, I think that's what I have, or that sounds really familiar. I want to know more about that. It is an involuntary reaction. So when you have any stimulus that triggers it, it's super, super frustrating because you can't just be like, don't do that, and your body listens. It's also a learned response. So it can be caused, and this is where that trigger warning comes in, by any histories of sexual trauma, abuse. And this doesn't have to be stuff that went on for years and years. This could be one instance, a one-off situation that messed with your nervous system and made you feel unsafe. This can also be caused by chronic conditions, chronic yeast infections, chronic UTIs, anything that involves the pelvic area that was inflammatory or painful or uncomfortable. So there are so many different triggers for this and causes, and your body remembers stimuluses. So when you have a painful response to something or a trigger response, you start to form neural pathways and your body will remember that response. And then when you have another stimulus later on, even if it's something highly desired or something that's supposed to feel good, your body might remember that. And ultimately, it's trying to protect you. But there are ways to unlearn that and build new neural pathways.
I liked that you listed things that could cause it. And it's not always one thing. And that's the biggest question we get when people come in is, why is this happening? And I think we addressed this in previous episodes before. I mean, it can be so many different things. Let's even another example that could be very specific, but let's say you come from a highly religious background and you've grown up with shame around sex, or just thought sex is only for conceiving, only for giving birth and having babies, and you shouldn't be having sex, and sex isn't for female pleasure. And maybe people aren't directly saying that to you, but that's how you have grown to see sex as, a teenager and into your adult life. And subconsciously you see sex as bad, even though you don't think it is, but like your body views it as bad. And then you could have this involuntary spasms or contractions of your pelvic floor muscles, making it difficult to be intimate with someone or have penetration into the vagina.
100%.
Or pleasure yourself or insert anything else into the vagina, whatever it is.
I love that you mentioned the religious piece because that just goes into emotional conditioning as well. And this is something especially that young women experience around sex. I was just talking to a friend of mine about sex education and when we actually learned things about our bodies, and it was at such a later age than you would think, just based on when you do sex ed in school, because it isn't really focused around women's pleasure ever. And then when you add conditioning from whatever it is, whether it's from like a denomination or just a family member or someone who is strongly opinionated in this way, when you're young and impressionable and emotionally immature, you're super susceptible to those things. Basically, you can internalize that and your body can recognize that too. And then later when you are trying to have sex for pleasure, your body might not know how to do that or want to do that. And that affects everyone differently. So it's definitely something that we address in our sessions. And we say, hey, this might be chronic. This may have been happening for a long time. It may take a little bit of time to start to work on it, but we can make a huge difference. This is my number one favorite thing to treat, if I had to put one thing at the top.
I think you and I both really like helping people that have pelvic pain. Dyspareunia is the fancy term you might see if you are Googling vaginismus or the symptoms associated. Dyspareunia just means pain with penetration or penetrative sex. The definition is pain with sex, but with penetrative sex, because you can have sex without penetration.
Yeah. The reason that this specific condition is my favorite is because I have seen 0 to 100% improvement in a much shorter time frame than you would imagine with this condition. So how we'll typically approach sessions is we will take wherever the person's starting point is. Basically, during our initial evaluation, if you've been listening, you'll know what that looks like, but we do a vaginal assessment or a rectal assessment depending on the needs of the patient. And for vaginismus, we would attempt to do a vaginal assessment. Some people can't even tolerate the entry of one finger into the vaginal canal at that first session. And within 2 or 3 months of treatment, we will be fully inserted into that third layer and applying pressure to trigger points and releasing those muscles. And that is a huge accomplishment. That is a ton of improvement. And it's one of the most rewarding things to treat because people are like, wow, I didn't know my life could be this way.
It literally gives me chills when a patient comes in and their goal is to be able to have sex with their partner again. And then we finally get there and you're able to have sex with your partner and it's not painful. It is amazing.
Yeah.
When that happens.
Yeah. Aside from working manually, what are some of the tools that you give these patients? Some big ones on the top of my head.
Guys, our biggest suggestion for this patient population, but we highly, highly, highly recommend you see a PT before you go out and buy dilators because there's some guidance that you may need when using these. But I already spoiled the surprise. It's dilators.
Dilators.
Yep. What are dilators, Hannah? These are dilators. Look at the screen, guys. I'm showing you. This may be a podcast, but we also record it, just so you know.
A video podcast.
Yes, we are.
If you're not watching the video, they basically look like vibrators or like a sex toy.
Or a dildo.
Yeah,
what
or a
they look
dildo.
like. We recommend the intimate rose dilators. It's what we provide in the clinic for when our patients need to purchase. And it's what I usually recommend to anyone because it's a silicone.
It's medical grade silicone. So it is safe for use. And they are a little bit softer than some. Like you can get hard plastic dilators on Amazon or wherever you would order that. But these are going to be a little bit more comfortable. So it's our gold standard for dilators that we use.
Mm-hmm. I would say some people do like to have a handle when using dilators. And that's a benefit I see from plastic dilators, but I think that they make a handle connection for these, which makes me like them even more.
They have an attachment.
So dilators are the biggest suggestion that we typically will give people with vaginismus. Now, not everyone. So we've had the talk about dilators versus pelvic wands, and maybe we can do a full episode on that again. But typically we will recommend dilators if people have that, I kind of call it the ring of fire pain where literally inserting a finger is painful and it feels tight all the way around or circumferentially feels tight versus a pelvic wand will help more if you have trigger points. Now, sometimes people use both, but if we're literally trying to get the vagina or the pelvic floor muscles used to stretching and expanding for a penis, for example, then we want to use dilators and we'll start off with something small, maybe like literally this little guy right here, which is smaller than my finger even.
Smaller than a tampon.
Smaller than a tampon. And then moving up slowly. And you're going to work with your PT. You don't have to do this alone. We will work on when to safely and slowly progress you to the next level because we don't want to move too fast and just go up to big O, you know? I use that term. Amanda says big O a lot.
And she stole it.
I stole it. And we don't want to just take you straight to big O because it's about slowly progressing your body and making sure you feel comfortable with penetration. So one, the pelvic floors can slowly stretch and become more willing to stretch for that. And two, so your body identifies penetration as safe.
Yes.
Now, something that I've been doing recently too with my patients, once we get to the biggest size dilator, for example, and it's like, okay, now I'm on this like big O dilator and it's the size of my partner, but you know, we've done the stretching, right? Well, now we want to make the connection of pleasure with stretching. So then I think it's really cool to start incorporating like a rabbit vibrator or something. I've been suggesting that to my patients lately. When all we've been working on is just stretching the pelvic floor and dilating. It's like, well, why don't we try to make this more fun now? Because that's what you want. That's your goal. You want to have sex and be intimate with your partner and feel good and be able to have an orgasm. So why don't we find something that is more pleasurable, but also doing the same thing?
I like that with the dilator use, like have the largest dilator inserted and then use the
Like a
vibrator
vibrator.
clitorally. Yeah. Because I know the pelvic people, they make the kiwi, which is, it has that insertional component and then you can use the vibrator, but it wouldn't be the largest size. It's more for that like ring of fire pain like you were describing. So yeah, that's really good. And guys, the reason we love dilators is because you might only be seeing your PT once a week, depending on your schedule, maybe even less than that. For something that's chronic or a trigger in the body, like I said earlier, building those neural pathways is really important, and that takes a lot of repetition. So if you're seeing us once a week, yes, we will manually try to see where you're at each time and stretch those muscles and work on whatever trigger points there are. But doing dilator work at home in between your sessions is going to be fundamental for that kind of care to actually work. If you are someone who has been recommended dilators, highly recommend Intimate Rose. We use them personally and professionally, and they are our preferred brand. We do have a code with them because we asked them for one because it is the brand that we suggest. And you can use our code Pelvic POV to get, I think, $5 off your purchase with Intimate Rose if you buy from their website.
And we'll put that in the link in the description in case you guys forget.
Yeah.
Or if you're driving right now or running or doing what you do. While you listen to us freak out.
Doing what you
Freak
do.
out.
Or dilating.
Maybe you're dilating right now. Heck yeah.
Heck yeah. I want to listen to us while I'm dilating.
I know. Who wouldn't?
Was that weird?
No. All right.
Anyway.
So, okay, let's talk about it, guys. Dilating. If you are a pelvic floor patient, you know how that little sad walk you do into the office when your PT, you're like, my PT is going to ask me if I dilated this week, and I just didn't do it because it's so annoying to do my dilating tasks. I know. We know. So what's your recommendation for dilating usually for people? What do you usually say? And I'll tell you what I say.
I would say my standard would be 5 to 10 minutes 2 to 5 times a week. So
Okay.
that's a pretty broad range, but it depends on the person.
That's close to my range. I say 10-minute long. I say 3 to 5 times a week. The more consistent you are, the better. And it's your healing journey, so it's up to you. But this is my like formal recommendation. Do I have any patients that actually do it 5 times a week? No. I don't think I have one patient that does it, but that's my formal recommendation. Do I even have people that do it 3 times a week? I don't think so sometimes.
So, and even if they do, it's not going to be what they do long term, right? There might be the first couple of weeks where they do it a little bit more often, but people do trail off and they find the frequency that works with them. So that's why we give a broader range for how many days to do this stuff.
When we understand how annoying it is to like get out your dilators and your lube and kind of like get it set up, and you might not have a personal space for it, you know. But I try to make individual goals with my patients, and I say, okay, I could give you my formal recommendation of 3 to 5 times a week for 10 minutes at a time. But are you actually going to do that? Like, look at me in the eyes and tell me, because if not, let's try to figure out a goal and a plan, because I would rather you do it at some point rather than feel this overwhelming like sense of, oh, I got to dilate and then I did it and now I feel bad and now I'm not prioritizing my health and now I'm spiraling and now this is going to take longer. Like, it's your own healing journey and we can take as long as we want. And at the end of the day, if you're dilating consistently, even once a week, and you're being intentional about it and doing your exercises, that's better than like hating it and doing it 5 times a week and just trying to push through and get it done. So I like to talk with my patients and set realistic goals every week so that you can come in and feel confident and not feel bad about being like, I didn't do my homework, you know?
And if you think about the repetition over time, if this is a pain that's been persistent for 5 to 10, however many years, if it is literally limiting someone from inserting a tampon or a finger and it's been that severe, and we get those cases often, think about even if you do it once a week, you're doing that 52 times over that year and you're getting that stimulus 52 times when you may have not had that for years at a time.
Maybe you haven't had penetrative sex or anything in the vagina other than maybe the speculum exam from your gynae 2 years ago.
And and a lot of our patients come in and they have not had speculum exams because they can't handle it. And
or have to use a pediatric speculum.
Yeah, or have to use a pediatric, or that's the reason they were referred to pelvic floor PT. So sometimes not even that.
So that's also why I tell people don't buy dilators without going to see a pelvic floor PT first, because we'll talk about frequency, how to use it, and we'll set goals. And then you'll have someone weekly to check in with to make sure you're on the right track.
Yeah.
Yeah. So that's one thing I'll do. So I'll set a goal and just be like, okay, this week, what's your week looking like? You got busy work schedule. You got meetings. Are you going to be able to dilate 3 times this week? No? Okay. What if we do 1 day of dilating and then 2 days of intentional stretching and movement for like a longer period of time? Does that sound realistic for you? Yes? Okay. Let's do it and check back next week. Okay, your work schedule is easier this week. What do you think? Can we do 2 days of dilating this week? We can change it up like that.
Yeah.
I really like treating this diagnosis, guys.
Yeah, we really nerd out about this. So if we're saying anything and you have follow-up questions on it, please ask us. We will do countless episodes on this topic alone. And there's so much we can go into. Like if you want a whole episode on that pain science, we can talk about that. Our 5 favorite exercises for it, things like that. So this is just kind of an overview and the general things we'll do for vaginismus, but it is not something we're going to talk about once and then leave it. So let us know.
Yeah, that'd be cool to do like a whole deep dive into the pain science episode. You tell us what you guys want though. This is more general, more for, are you the person that's getting in that Google rabbit hole, just like we did with the endo episode? Are you Googling and you found, okay, maybe I have vaginismus, or the doctor said that and you're confused and lost and don't know what to do? This is for you to have a more clear understanding of what to do and where to go next.
Yeah. Absolutely.
I mean, we use our typical things that we've mentioned. We use dry needling techniques. We use exercise. We use flexibility training, stretching of the accessory muscles to the pelvic floor, like your glutes, your hamstrings, your hip flexors, things like that. All will help with getting you better tolerance to penetrative intercourse. We specifically wanted to talk about dilators with you guys because we get a lot of questions about them. Don't use silicone lube with them though.
Water-based lubricant with silicone vibrator.
Water-based lube
with silicone dilators. That's the combo. Your silicone-based lubricant will break them down, so don't use that with them.
Another question I get, well, Hannah, I have a dildo. Can I just use that instead of the dilators? Well, I mean, you could, but can you tolerate that? We want to start with dilators because you can start with this tiny guy and slowly work your way up to big O,
Yeah. Ideally, you want the least amount of pain response to the stimulus as possible. That's what's going to help retrain your body. So if you insert a dildo and it is painful the whole time, you're probably not improving. You might not be making it worse, but you might not be building those neural pathways that we need to be building. We want that to be a pain-free stimulus for the most part.
What other questions do you guys have about vaginismus?
It's a big one. So do not feel like anything you ask is stupid or should be common knowledge, because we get so many questions on this and we love talking about it. So yeah, just let us know.
And don't feel ashamed. If you feel alone, you're like, why can't I tolerate this sex with my partner? What's going on? So many more people have this diagnosis or have symptoms of this diagnosis or are similar to this diagnosis than you think. And people just don't talk about it because that's what this podcast is about. We're advocating for it so we can talk about it.
Yay. Advocacy.
And help you guys out.
Yay. So. All right, guys. Make sure you're following us on social media at Pelvic POV. You can submit a question for us there at the link in our bio. If you have anything you want to add, you can also shoot us a DM. We'll respond.
And also go snag our merch, pelvicpov.co. Pelvic Freak merch, guys.
Pelvic Freak merch is here.
And lastly, if you want to use our code, it's Pelvic POV for $5 off your dilator purchase or any other things from Intimate to Rose.
All right. Bye, Pelvic Freaks.
Bye, Pelvic Freaks.